This week's budget has brought healthcare reform into the spotlight, including key changes proposed for Medicare. They include a triple bulk billing incentive for older patients, children and concession card holders, funding for multidisciplinary healthcare and funding to support GPs in reducing the burden on emergency departments. Macquarie Health Collective and Valley Family Practice Chief Executive Officer and psychologist Tanya says while these changes are a step in the right direction, they may not be the silver bullet we need. And she joins us live now. Thank you so much for your time, Tanya. So yes, it's certainly a step in the right direction, but more is needed.
Absolutely, Janie. Hi, thanks for having me. Look, I don't envy the government. I know they have really, really difficult decisions to make. And it has been nice to see this week that there has been more attention and more resources put towards general practice and primary care. But we certainly have a long way to go still. This is a start, but I really hope that the government can continue to invest more and that we can see further steps in this direction.
Well, let's talk about, first of all, psychology. You are a psychologist as well as being the CEO. Talk us through what has happened in terms of appointments to a psychologist, because I know the budget reply, Peter Dutton, criticised the federal budget this week for cutting free psychology sessions from 20 down to 10. Do you think that is a good statement and a good announcement?
Look, Janie, I think the change from 20 sessions to 10 that happened at the end of the last year was a terrible, terrible decision. I have always been a busy person as a psychologist, but if you think of everything that's happened in the last few years, we're talking multiple natural disasters, we're talking a pandemic. It's been a really, really stressful time. That's not the time that we want to see less investment in psychology appointments. We really need more. We know that our wait times for psychologists are outrageous. We know that we need more psychologists on the ground, but we also know that for the psychologists that we have, we need to make them more accessible, and reducing the number of sessions available is absolutely working against the goal.
In terms of psychology training, is it a 6-year degree? Then you've got other counsellors and so forth. So do we need to see more training for experienced psychologists up to 6 years? Do we need to get people in early? What do you think needs to happen in this crisis period?
Look, maybe a bit of all of the above. I think just like we've talked about in general practice, we're trying to find creative solutions to address the problems that we have. We can certainly do the same when it comes to mental health care. Absolutely, we need to see more psychologists. We need to see people who have that extensive level of training, because that can be so important for so many people. But we also can think creatively about what else we can do. How do we draw upon our counsellors during a time like this? How do we draw upon our social workers during a time like this? How do we draw upon our mental health OTs? There are so many people that can be contributing to the problem that we have. We just really have to be able to think outside the box.
You also are a teacher for Sydney University in Dubbo. You teach upcoming GPs and the like. What are they saying about this? Do they want to be GPs? Do they want to be psychologists? What is the word out there?
Look, I think the statistics speak for themselves, but certainly whenever I talk to the students that I teach, they are not choosing general practice. That's not because it's not an amazing job that comes with lots of great lifestyle factors, but unfortunately it pays nowhere near as much as the specialist pathways. Now, no, it's not all about money, but absolutely that's going to be a factor. Doctors have families too. They have households to run. And so, of course, they need to make financial decisions. If a doctor knows that in completing medicine, they can choose a specialist pathway and earn 3 times the money that they can earn as a GP, then you can see why they're making the choices that they are. We have seen a considerable drop in the number of people choosing the general practice pathway. And at the moment, there's really significant concern around what is going to happen over the next 5 to 10 years as we see fewer and fewer GPs in our workforce. We already have major access issues. What happens when our workforce continues to drop?
And are we seeing, doctors leave and, whole places basically leave as well? Like what's the domino effect here?
Absolutely. We have seen many, many practices close. In my town itself, we've seen 3 practices close in the last 12 to 24 months. And I heard a statistic this week that in the last couple of years across Australia, we've seen 60 practices close. That's really, really concerning. We know that there is an issue when it comes to the financial viability of general practice. And that's why we're seeing so many people advocate for Medicare reform. This is not GPs being greedy. General practices are exceptionally expensive organisations to run. And so the reason that we need to see Medicare reform is to increase the financial viability of general practices and of this profession. If we don't start to see some of those more significant changes, then I fear we will see fewer and fewer doctors choosing to enter the pathway. We will see people leaving the profession. We will see practices closing. This is a huge concern for people Australia-wide. This is not just a rural issue. This is an Australia-wide issue. And it is going to mean that our access to general practice becomes more and more challenging over time.
And finally, a triple bulk billing incentive for older patients, younger children and concessions. What's your take on this? And if you do think it needs to change, what is your opinion?
Sure. Look, it's a great start. Like I said at the beginning, they have a difficult decision to make every budget. And we can see here that at least they've increased the investment that they're making in general practice. That being said, I would say for the majority of GPs, unfortunately, they will continue to private bill beyond this. The tripling of that incentive and what that will equate to for a doctor is still less than what majority of practices are charging privately. And I would imagine then to ensure that they can meet their own rising costs, they will continue to private bill. What we really need to see if we want to ensure that families have affordable access to healthcare is true Medicare reform that adequately adjusts the overall rebate for a consultation.
And just before we let you go, a couple of weeks ago, there was the announcement about medication. The PBS was saying, 60 days worth of medicine for half the price. Can you explain to us what that is and what your thoughts are on that?
Yeah, certainly. So the 60-day dispensing rule came out recently. The government announced that they were going to do that prior to the budget coming out. And what that means is that when you receive a script from your GP, you will be entitled to access 60 days of medication rather than 30. So therefore, you don't have to go back and see your GP as often to get scripts. And also you don't have to present to your pharmacy as often. That sounds really exciting. But unfortunately, what it means is that there's significant implications for pharmacies. So every time you go to the pharmacy, the pharmacist is paid a dispensing fee. And so if they are now receiving 50% of their dispensing fee income that they had until now, then of course, that's having a huge impact on their overall revenue. There is really, really big concern that this will have implications for pharmacy in terms of job cuts and potentially even pharmacies having to close as a result of this. Now, I appreciate that the government have really challenging decisions to make and that there are some pros to this. But I would say at a time like this, after the last couple of years that we have been through, I don't think anyone in the healthcare industry should have to take any hits. And unfortunately, that's what we're going to see for pharmacists.
All right, really appreciate your time and expertise. Macquarie Health Collective and Family Practice Chief Executive Officer and Psychologist Tanya Forster, thank you.
Thanks, Janie. Happy Mother's Day.